Hello, everyone. My name is Abigail Riggenbaugh. Like Katie said, I'm a research coordinator here at National Center for Farmworker Health. And today we're going to be talking about best practices for phone and virtual interpretation. National Center for Farmworker Health is a private nonprofit organization located in Buda, Texas. Our mission is to improve the health of farmworker families. Today, our learning objectives, you'll be leaving knowing how and why to utilize phone interpretation services for any of your limited English proficient patients. You will also leave knowing what to do when common issues arise during the process of connecting with an interpreter virtually or on the phone. And then also you'll leave knowing some resources for how to determine languages and language varieties when you encounter with patients. Today's speaker is Veronica Godinez. She is a qualified legal and medical interpreter. She also worked as a contractor interpreter for Catholic Charities and Bay State Interpreters Incorporated in Boston, Massachusetts. She was in charge of the interpreters department at Kanza Prairie Community Health Center in Kansas. And I'll pass it on to her. Thank you so much, Veronica.
Hello, everybody. Thank you, Abigail, for having me today to share a little bit of my experience. So I can say that I'm originally from Guatemala, born and raised. I had experience as an interpreter since 2018 back in Boston, and then we moved here to Kansas. And I was in charge of the interpreter services for the clinic. It's a community health center. And we had 4 Spanish-speaking interpreters on site in person, and 2 Pashto, Dari, and Farsi interpreters for our population Afghan refugees that they are here in Manhattan, Kansas. By the way, I don't speak Pashto, Dari, or Farsi. I'm only bilingual in Spanish. But I was in charge of the interpreter services, all of them on site in person at the clinic. The clinic had 3 clinics, and the interpreters were in each clinic, and the ones that were moving around were the ones for Pashto and Dari. So let's just start with the first slide. So we're gonna talk about the interpreter role. So basically the interpreters provide verbal interpretation from one language to another one. That means the interpreter is gonna be the bridge between the patient and the provider or the medical staff. That's the main role for the interpreter, like transmitting the message, the full message from one language into another one. But we also, as an interpreter, we have our other roles, like being an advocate for the patient at some point, a cultural broker that we're gonna talk about that later, and facilitate the understanding or clarify what's going on in the room or in the appointment. So these interpreters are contracted to interpretation agencies or are trained and qualified staff. So in my case, I'm a qualified interpreter, but we also can have certified interpreters, which are certified through the National Board of Medical Interpretation or the Certification Commission for Health Interpreters. So the qualified interpreters are interpreters that they take a training for 80 hours, 70 hours, 40 hours training, and get a certification for that. That helps you with the medical terminology, part of the body, how the code of ethics for interpreters, everything. So you can have qualified staff, or you can have medical interpreters qualified to be in the room with the patient or with the providers and medical staff. So they can provide services in person, via telephone, or to virtual platforms. So in my experience, I used to be a contractor back in Boston in person. And after COVID, we had to take appointments over the phone, virtually, telephone, or through the iPad or tablets. And basically, patients prefer either or as soon as they have a person who helped them out in their appointments. So all this remote interpretation started like way back in 1970s in Australia. And then with the improvement of technology, now we have access to telehealth appointments. It doesn't matter if they are medical appointments, behavioral health, only obviously dentist appointments cannot be virtual. Like some appointments require interpreter in person or can be via telephone, but it's kind of hard when the patient has his mouth open and they are working on them. But it's good, or it's important to have an interpreter for people that doesn't speak the language. With the remote interpretation, now with the telephone and iPads and video, we have an increase of accessibility. Now we avoid the travel time for the interpreter. Like in my case, when I was a contractor, I had to go from one place to another one. I have to take in consideration the travel time. If I find a parking spot back in Boston was pretty hard, or how far I can park to go to the appointment. And those challenges now are less or are limited with the virtual interpretation over the phone or through the video calls. They have some disadvantages as well and challenges that sometimes the view is limited. Like when some of our patients cannot have good, like they're not very tech. And I don't know in your cases, like older patients, like in my dad's case, I can give you this example. When I call him, he's back in Guatemala. So when I call him through FaceTime or something, I can see half of his face or I can see the roof. And I have to ask him like, Papi, can you please put your face? Because that helps the communication if you have a person in front of you, and you can have more rapport with the patient in that case if they see your face. And if the patient prefers, have a video call. So, and sometimes any other troubles like the audio you cannot hear well, or is a lot of noise in the background. Sometimes the patient is not able to have a private room. So you can hear the kids, the pets around, the TV's on, and you can hear more the TV than the patient. So sometimes that can be challenging. The next one. So what people don't know, or what I think they should know. So we need to have cultural considerations and have cultural awareness of what is the population we are taking care of. Mainly, I will love the providers to have this a little bit more, because sometimes they just see the patients as all, and we all come from different backgrounds, we all have different cultures, and it's good to know what population you are treating and what kind of population you are serving. So the preference in-person interpreter, most of the people, according to my experience, prefer an interpreter in person, because you can see the face and you can see the familiar face every time you go to your medical appointment. Is the same person or a couple of the same familiar faces. So you feel more comfortable talking about the issues you're having. I don't know if it's something medical or something in behavioral health. If you have the same interpreter, will be ideal. Unfortunately, sometimes that cannot happen. And as soon as we have the language line to access interpreter services, is all that matters, that the patient have a person who can help them out in speaking in their own language and understand what's going on. So some people don't like the iPad, actually. They prefer a person. And when we have the iPad or the tablet or a video call, they prefer to have a phone call or turn off the camera so they can only hear the person. Probably if they have another person in the room that they don't know, they don't feel totally comfortable to speak about the medical issues. So it's what the patient prefer if they have the luxury to pick in person or phone or video call. Talking about gender preferences. So again, talking about culture, we need to be aware of what we prefer. Like in the Latino culture, or in my culture, we prefer, like if it's a female appointment, like gynecology appointment, or pap smear, or mammogram, we prefer, in the case, having a female staff, a female interpreter, a female provider, or medical staff to check on these type of things. That's our preference. But I can tell you, when I start working with this population, Afghan population, for them it's not only a preference, it's religion as well. It's something that is mandatory by the Islam. Like if you are a female, you should have a female interpreter, a female provider, or a female medical staff, unless it's an emergency or is not any other option, right? So we need to be aware of these cultural preferences or this religion information, so we can provide an accurate and the best quality of care, if possible. Sometimes I know our budgets, the companies, the clinics don't have the budget to have many interpreters who speak different languages, and female for females and male for males. But as much we can make this possible to provide a quality of service, will be perfect. So then something very important that I think most of our population is not aware, that they have the right for a free interpreter, regardless of their legal status, insurance status, race, religion, weight. It doesn't matter. They have the right. If they don't speak English, they have the free right to have a free interpreter. And that's was started in the Title 4 of the Civil Rights Act of 1964 and the Affordable Care Act Section 1557. So this one says, any healthcare provider that receives funding from the federal government is obligated to take reasonable steps to ensure meaningful access to health services for LEP individuals, including receiving services in their own language, which means that any person is legally entitled to get an interpreter for their appointments for free. So people don't know. People, sometimes I see a lot of people at the clinic that they are illegal, they're undocumented, and they think because of that reason, they're not citizens, they are not under Medicaid or Medicare, they cannot have an interpreter. But we need to make them aware that it's not based on each person, it's based on if the clinic is receiving federal funding, we are required to provide interpreter services in any language for free at no cost. And sometimes we establish that in the beginning of the paperwork when people fill out the forms to establish care in a clinic, in a health center. And sometimes we can provide this information so people are aware that they can have these services. If any facility that receives Medicare, Medicaid, EBT, food stamps, anything that they receive federal government money, they are entitled to, they are obligated to provide these type of services. So, and they also have the right to report not only the patient, the people who are witness that this organization is not providing services for the Spanish-speaking population, for the French-speaking population. They have the right to report the healthcare centers for not providing this interpretation. And they can just call the HHS, which is the US Department of Health and Human Services Office for Civil Rights. And the phone number is right there, is 800-368-1019. And you call. They need to wait, if they're Spanish speaking or any other language speaker, they need to wait for the COVID information and then the schedule time, and then they can press 2 for Spanish, and they can make a complaint about they are not receiving services. I understand that our population that is undocumented and they're afraid to report this type of issues. Maybe they need the interpreter or another person to support them and explain to them that is the right. There's not something bad that they're going to happen to them. It's just to report this clinic so they can make these appointments and medical care easier and accessible to them. Next one. Okay, identifying language. Identifying language and or varieties of language dialects is necessary when looking for an interpreter. It's important to identify the area, the community, again, knowing the population we are taking care of to see what are the needs. Like if we have Spanish speaking, but they are coming, or the seasonal workers coming from Guatemala, which is my country, I can talk about this. We can have a variety of languages. In Guatemala, they speak over 24 languages besides Spanish. There are 22 Mayan languages, plus other two, which is Xinca and Garifuna. So if we know that we have this population probably living around us and they will need interpreter services, then NCFH has it's going to have a great resource for you, which is a map when you can see per state in the United States, per color, what languages or variety of languages they speak. For example, if it's Kansas, or you can see all the little colors, you'll see it's an amazing resource that is not available yet, but it will be. And Abigail can tell us about a little bit about this later. But you can identify the communities, what language are spoken in the United States per state, which is, I think it's a great resource and is very helpful when you're trying to find this other variety of languages that they are not like a big population that speak, but they are here in the United States, working in the United States, and they need interpreter services like Cachiquel, Quechí, Pocoman, that's in Guatemala, or like Mexico, that Mixteco, Zapoteco, and all these variety of languages that they are. Asking the patient about their native language directly can be an issue to discrimination and violence. Sometimes we need to avoid to profile or assume that the patient speaks Spanish in this case because of their last name, because of the way they look, because of anything like that. That can be discrimination, and we can know profile patients in that way. I can give you an example that happened to me with an interpretation on site, in person. So this lady came to the front desk. It was the last appointment of the day, so it was around 5:30 p.m. So she checked in at the front desk and they called the interpreter. I was available at the time. They called me. I introduced myself, hello, I'm Veronica. I'm gonna be your interpreter. She gave me the look like, okay. But that was just like that. Okay, we took her to the room. The nursing staff started taking her vitals. Patient was not speaking at that moment, just making weird faces, like whatever faces. And I was interpreting in Spanish, the vitals, temperature, blood pressure, all this. But the patient seemed odd, like she was like kind of lost. She didn't want to be in the appointment. So at some point, she was not even answering the questions from the nursing staff. So the nurse, when she was in the back, she gave me the look like, what's going on? So I have to throw the $1 million question, and I have to ask her in English, excuse me, ma'am, do you speak Spanish? And she said, no, I don't speak Spanish. I don't know. When I came, the lady spoke to me in Spanish, and I say, okay, whatever. And then you came, you talked to me in Spanish. But unfortunately, on that time, what happened was that it was the last appointment of the day. The window that she go to the front desk, it was a bilingual person, which had the first mistake, I can say, just profiling the person because of her last name. It was a Spanish last name, Latino last name. And then they called the interpreter, which was me. And as soon as I get the call, I said, okay, they need Spanish. So I start interpreting and speaking Spanish, but the patient didn't say anything until I asked the question. So we need to avoid this type of situation. It's very embarrassing. I have to apologize. Like, I'm so sorry, because it shouldn't happen that way. We shouldn't profile this person based on their look and based on their last name. Yeah, she said, I have Mexican parents, but they never spoke Spanish to me. So I was born in this country and I don't speak Spanish. And it was very unfortunate. And she thought, like, because it was late, the last appointment, only the English staff was gone by that time. So we have only Spanish speaking. Unfortunately, the front desk lady, myself, and the nursing staff, we were all Latinas. So she thought, we don't have English speakers at the moment. But we need to avoid this type of things. Other things happen to me, and sometimes I don't know if it's a compliment. I don't know if it's an insult. When I said I'm from Guatemala, I have people saying like, but you don't look Guatemalan. So what do you mean by that? So we need to avoid these type of situations because can be a discrimination or violence profiling picture. We can use also the I speak cards, which at the clinic we used to have like business card size, which says, my name is, I speak Spanish or French or Portuguese, Arabic, wherever. I need an interpreter. So people can have that in their wallet or their purse or wherever. So they go to their appointments and they can establish at the moment that they need an interpreter. Unfortunately, no, this doesn't happen all the time. That, oh, you need an interpreter, we're gonna have an interpreter for you. Sometimes it's, I'm sorry, we don't have interpreter. And they need to figure it out, having a family member, a person who helps them out. But those I speak cards are very helpful. You can go to Google, download it, or your health center can provide one for you. Print it out. We print a lot and we laminate it for them. And then we were giving it to our non-speaking English patients so they can use as a resource when they go to any appointment to have an interpreter. Set up a language match call an organization that provides interpretation services. So this is very helpful, and you're going to see at the end in your resources too that you can have translators as well for translating that's written from one language to another one, documents. You can have people who can find other variety of languages, and if you are not, or your organization won't provide this type of languages. Some of the language lines don't have this type of varieties like Mayan languages or Azteca or Mexican languages that we speak and we have in our country. The next one. Okay, so best practices on using interpreters via telephone or virtual call. Allow enough time for appointments. This is very important. So if you are either if it's in person or video call, if it's in person, you have the luxury to see what the appointment is for. You can research the words or the vocabulary if it's a medical interpretation, and will be probably smoothly. When you have a telephone appointment or virtual appointment, usually, based on my experience, I don't have information about the appointment. I don't know if the appointment is for blood pressure, if it's for heart disease. I don't have this information. So I cannot be preparing that terminology, but I can be preparing the way that I can have enough time. I can check if my device has enough battery, if my devices like my headphones, my speaker, everything, if I have a quiet room, so I can take the time and be calm and prepare for the appointment with the patient. Build rapport with the patient before interviewing and communicating about health services. Building rapport is very important because when you don't speak the language, you are going to a medical appointment. Is already uncomfortable if you are in pain, and if you hear the person in the other line and the other side of the line rude or like no interested, or okay, I'm here appointment because I'm here, it's not going to be nice for them. So you can still transmitting or deliver the same message with different tone and with kindness, polite. You can still remaining neutral, but at the same time being polite and nice. You don't have to be friends or something. It's just building rapport so the patient can feel more comfortable to speak about the issues or what's going on during the appointment. Then it one says provide HIPAA statement about confidentiality. So HIPAA stands for Health Insurance Portability and Accountability. So HIPAA basically protects the privacy of the health information from the patient. So what means that when we introduce ourselves, it's like, good morning, my name is Veronica, I'm gonna be your interpreter. I'm gonna repeat everything that is been said in the room. And I just want to let you know that everything that is being said is gonna be confidential. That means we can now share this information outside of the medical team. If you think confidentiality is a big terminology or they don't understand, you can say everything that you said is going to be confidential, or it's going to keep we're going to keep this information and we're not going to disclose anything besides of the medical team. So that's important to let them know, either if it's in person or via telephone or virtual call. Always you can do it quickly. You know, sometimes we don't have the time. Most of the time we don't have the time for a big introduction. Just introduce yourself, polite, kind, build rapport immediately, and right away you can do the HIPAA statement quickly, confidentiality. Speak directly to the patient using the consecutive mode. In medical appointments, we use this mode. We have different modes of interpretation, can be simultaneous, which is at the same time of the speaker. But in medical appointments, we use consecutive mode, which is when the speaker pauses and allow the interpreter to repeat. So it's more accuracy, understanding, and if it's time for clarification if the patient is not understanding. So the patient speaks, then the interpreter repeats, and then the provider, and vice versa, like that. We process and we ask or prefer that the speaker speaks in short sentences so we can repeat everything as is said. Maintain direct communication and interpreting in first person. So this is very helpful when it's a virtual or telephone interpretation, because usually Latino population has more than one person in the room when we're with the provider. And we need to speak in the first person. Like if the patient say, my back hurts, the interpreter is gonna repeat, my back hurts. And we can encourage the providers to do the same thing with the patient, speak directly to the patient. I have providers that they say, okay, can you ask her if she took her medications last night? And we can encourage the provider in a polite, professional ways, like ask the provider to speak directly to their patient that they are speaking in the same language. So instead of asking, the provider is saying that if you take your medications yesterday or last night, you should say, did you take your medications last night? So it's in the first person. And when it's another person in the room and you are in a video call or a telephone call, and you hear more than one person, you need to switch so it's no confusion. The same example, the patient saying my back hurts, but the grandma is in the room and she said, oh no, she didn't say it was the back, it was her neck. So the interpreter should say my back hurts, and the other person in the room is saying that she didn't say the back yesterday, she said it was her neck. So the provider understands who's speaking and who is saying what. So that's why it's important to speak in the first person and repeat everything as is said. Next one. Speak a slow and even pace, repeat everything that is said and check for understanding. Sometimes it's not in our hands when the providers are speaking in long sentences or with this high-level terminology. We as interpreters, we are required to repeat everything that is said in the way that is said. If the provider is saying you're gonna have a CT scan and an MRI tomorrow, the interpreter should say you're gonna have a CT scan and an MRI tomorrow. And it's when you probably know that the patient is not understanding what a CT scan is and what an MRI is. So it's when you as an interpreter, you start clarifying for the patient, and you can tell the provider, I think the patient is not understanding. Can you please put those terms in a simple term so I can explain to the patient and the patient can understand. So you can advocate for the patient and clarify this situation. And checking for understanding. You can also tell the provider or the medical staff, can I ask for clarification, or I need to ask the patient if he's understanding, and you can ask, Señora, ma'am, are you understanding? And if she said, I have no clue what he's saying, so you have to tell her. She's telling me, I have no clue what you're saying. Can you please elaborate more, put in simple terms so the patient can understand? And you at that time are playing like different roles, transmitting the language, transmitting the message, advocating for the patient and clarifying the situation. Sometimes providers use teach back, which means is asking questions to see if the patient understood what it was saying. So that's the famous term of teach back that is very helpful, so the providers can see if the patient understands or not. Use certified interpreters or train qualified staff fluent in English and the language for interpretation who are familiar with healthcare terminology, their purpose of work, and are aware of the code of ethics for interpreters. So the code of ethics for interpreters is basically a set of it's a guideline for principles that the interpreters should follow during the appointments. And basically is to represent both parts, the patient and the provider, fairly. You have to be neutral, you have to transmit the message accurately and in the same way that it's saying. So if the patient is saying, ay Dios mío, my back hurts, you have to say it, oh my God, my back hurts. So no imitating or making fun of what the patient is saying, but trying to deliver the message in the same way so the provider can understand. It's important to repeat everything that the patient is saying, how it's said, because for example, in behavioral health appointments, that will help the provider, the therapist, or the psychiatrist to understand the state of mind of the patient. If the provider say like, hey, how are you? How you doing? And the answer is, yesterday was purple. The interpreter has to say, yesterday was purple. So the provider will understand the state of mind, what's going on, and have a better diagnosis. As interpreters, we can know add or omit or give our personal opinion during the appointment. That's very important. And it doesn't matter if it's in person or via telephone or video. So that's very important. If people know about the code of ethics, is basically do no harm, right? Like the medical, that doctors, and is maintain yourself professional and advocate for the patient when it's necessary, and always ask permission for clarification. Sometimes I encounter medical providers that they're not very helpful. Like when you say the patient needs clarification about, you say you're gonna have an X-ray, and I say the patient is not understanding what's an X-ray. The provider, an X-ray is an X-ray, what I can say. So you can politely say like, I'm gonna clarify this with the patient, and you can say, if the provider allow you, the X-ray are kind of pictures that they're gonna take from your chest in a machine. So the patient have an understanding. If the provider is an X-ray, it's an X-ray. And unfortunately, we find or have these type of providers that they are not very helpful or aware of the situation.
Veronica, we have a question in the chat. How can you know if a staff member is qualified to be an interpreter? And how do you assess fluency in the language that's needed for interpretation?
So when it's a medical appointment, you know, medical terminology is huge. It's huge. The good thing with that part is that the patient will never use the big terminology. It's gonna say my neck hurts, my hands, or I have pain, or is shortness of breath. Probably the provider is gonna use the terminology, and you need to know that terminology in order to interpret for the patient. But you can ask for simplify the terms or the words or the vocabulary. But how we know if the staff is qualified? So fortunately, because of the lack of qualified interpreters, organizations tends to pull people that they're bilingual. Oh, the patient is here, doesn't speak English. Oh, call the person that works at the pharmacy. She can translate for us. And it is happened a lot. So what happened at the clinic, I can tell you what I did, and I know everyone can do it because there are resources for everyone in the United States. So we didn't have people qualified interpreters when they applied for the interpreter position. It was in Spanish at that time. I have just bilingual people, no people trained as interpreters. So I was in charge of interpreter services. So I took them and trained them into the room. Like I took them with me to observe first. And then I went to the room with them so they can do it and I can observe. Meanwhile, and luckily, my organization has some funds so we can pay for the certification. I think it was 40-hour certification through a program. And the next year, we found, I don't know if I can say it, but I'm going to say it. ALTA is one of the organizations here in Kansas. I don't know in the rest of the United States, probably in the rest of the United States. So if you are working in a health center, they pay for this certification. Is through United Healthcare, health insurance. They pay for this certification that is $900. They pay everything, and you just take the training and get the certification. If you work in a health center, you don't have to pay anything because it's the way that they are trying to help out people to get qualified to provide interpreter services. So when we don't, and you can get trained, and at some point, if your organization is paying for that or anyone else is paying for that, it's a win-win because you're gonna learn something if you wanna follow that pathway, being an interpreter, so you can get your certification as qualified interpreter, and the organization has a person who is qualified to be interpreting for the patients. When I try to see who's qualified or how we can determine who can help us out is if people has any background. I have staff that they were studying for their CNA for nursing staff, and but they are not doing that yet. But they study or they have how many years of this. So if they have a little bit of background in any type of medical background, if they're studying for nursing staff, if they work in a clinic in another clinic or a doctor's clinic and a hospital for several years, for all these people who's going to have more qualifications than a regular staff that is just bilingual. So I think it's the way that we can address to observe the person who is the supervisor in charge of that can train these people. It has that opportunity. But there are a lot of resources out there. You can look in your state if there's any organization that they can pay for your interpretation certification. Will be great. I don't know if I answered your question, or if not, let me know and I'll try to clarify.
I think we can move forward and we'll wait in the chat for a response.
Okay, special considerations for telehealth appointments. Ask patients' preference if they will prefer video or audio only call. Sometimes what happened to us is like when the interpreter in person is booked or, I don't know, called out, or we don't have enough interpreters in many patients at the same time, we try to use the language line, which you're gonna see later we used to use Propio. Some of the patients, as I told you, they don't like to see another person that they don't know. So sometimes works better just audio, and sometimes people like to see another person. For the interpreter side, is better if you can see what's happening in the room, because you can tell how many people are, how the patient is expressing themselves. So having a visual information will be better than only audio, but it depends what the patient prefers. If they have the luxury to prefer, I prefer this or I prefer that. Some of the time this is what we have, and they just take it. Ask the patient to find a quiet, safe environment with limited distractions. That's another hard one because sometimes our population don't have like, oh, I live in a house with 5 rooms and I can go in a room where I can have a quiet space. But it's better if they have a quiet space so the interpreter can help. It's going to help the interpreter to say everything and have accurate information and not with a lot of background noise or a lot of distractions. The best practices for interpreters have like the interpreter should have a private room as well with good internet like the patient or good connection, hopefully in front of the camera so we can see what's going on in the room and they can see the interpreter. Try to keep neutral and professional. And it's good if we avoid, that's a very hard one for me to use our hands. I know sign language in Spanish, so I work with deaf population for 5 years. So for me, it's very hard. And sometimes I feel if I don't move my hands, I cannot express myself in a better way. But it's better if we avoid that, because if I'm doing this, it's gonna cause distraction for the person that is on the other side if it's a video call. And facial expressions. Sometimes we're gonna hear things that maybe they're shocking for us, or maybe sad, or maybe disturbing. I don't know. We need to, or try to keep our face straight, so that is not gonna be something that they say you're judges me. Oh my God, I'm sorry. People who is bilingual can understand that sometimes your English and your Spanish are not working properly, and sometimes are both. That happened to me many times, but hopefully, it's better if we avoid these facial expressions when we are in an appointment, so we can remain neutral and the patient feels comfortable. And when it's a telehealth appointment, if it's only a call and no only audio call, you can ask as an interpreter, is there anything I should know before we begin? Is anyone else in the room? So you have a better understanding of what's going on. And please, as an interpreter, feel free to ask for clarification or for more information, because the goal is deliver the message as better we can. If we don't have the visual part, we can ask for the rest, like, is anyone else in the room so I'll be aware and I can do my interpretation better, or something like that. So ask for more information. Don't feel weird or like, oh, I'm gonna ask for all this, because the goal is to explain everything, what is happening and as it's happening. Okay, the next one. So as I told you, in our clinic, we have this on-site interpreters, but when our interpreters on site are busy or booked, we use Propio. They are different. There are several companies that they provide language services that you can use, and it's not only for Spanish. They have variety of languages like Arabic, French, Spanish, all these languages. And the way that they work usually is there is virtual, so they can be video call or just a regular call, phone call. And you basically just call the number. You have to have a contract with them. Then you call the number and then you dial the number. If it's Spanish, it's going to be 20 something or 2 or whatever number they assign to the language. And then they connect you with an interpreter. Is the way that the language line services work. And they also provide, some of them, translation, which is written if you need a document to be translated into a different language. They provide that service. And for interpretation, they charge per minute. So as harder is the language, as more expensive it is. The next one. Okay. If you notice that the interpreter doesn't use the correct, doesn't speak the correct language variety, seek a proper interpreter for variety before continuing. If there are any connection issues, ensure the phone or video connection and quality before moving or reschedule. So what happened is, it's not sometimes we don't speak the same language. Sometimes we have slang, and that happened to me many times when I'm from Guatemala. I have a person that is from Puerto Rico. And a quick example, one time she was saying that my batata hurts. For me, in my Spanish, I don't have any part of the body that it's called batata. So if you have this type of, like we call, in Guatemala, we call the legs, we call canillas. Ay, me duelen las canillas, like, ay, my canillas hurt. But canillas for someone, it doesn't mean anything. So if you have that type of situation, feel free to ask the patient. In that moment, when she said my batata hurts and I didn't know what the batata was, I asked her, like, can you show me where your batata is, or can you point where's the batata? And she showed me her cup. So the translation for calf was in Spanish is pantorrilla, but in Guatemala we call it camote. In Puerto Rico they call it batata. So when we have all these issues, we can just ask the patient to point or show us what the part of the body is if you don't understand what they're talking about. And if you have connection issues, it's cutting off or whatever, it's better to reschedule, because the provider has patients back to back, and we don't have the luxury to say we're going to take 20 minutes to find another interpreter or a person who can understand. Okay, telehealth setting, ad hoc interpreting and using bilingual family members as interpreters is highly discouraged. The interpreter should be, if the patient requires an interpreter, should be all the time, every time the patient is at the clinic, not only as needed. And bilingual family members in the Act 1557 established that no family members are allowed to interpret for the patients, and no people under the age of 18. Sometimes we don't have that option because it's no one else who speaks the language and we need to use a family member. Or if we have interpreter services, language line, and the patient refuses to use an interpreter, and because has the family member with them, and for that, if that's the case, you can use a waiver for interpreter services, so you can protect your clinic, like the patient refused the interpreter services, and is going to use the family member or the friend or something like that. A quick example, what we are avoiding this type of situation, we have a patient that denied the interpreter because they have a family member. He went to the pharmacy complaining that he received a bottle with only 10 pills, and the friend told him that the label says that he has to take 11 in one day. What happened was the label says once a day, and if you speak Spanish, you know once spells as once, which means 11. So the patient came to the pharmacy complaining that one pill was missing. Thankfully he came, because if not, he's gonna take like 11 pills at once, because the family member was interpreting for him, and he told him once is 11 one day, 11, you have to take 11. Luckily the bottle has only 10 pills because it was for 10 days. So this type of situation can harm the patient if they don't have a qualified interpreter. And we need to make sure that when we are providing interpreter services, patients are aware that it's free, that is at no cost. It doesn't matter insurance status, legal status, they don't have to pay anything, because it's a right that the health community service or whatever the health department or the clinic needs to provide. Okay. And this is the resources I told you about, the Indigenous Language Variety Identification Guide that is not published yet. And Abigail can tell us a little bit more about that. It's a great resource you will have with all the Mayan languages and variety per state.
Thanks, Veronica. Yeah, we're gonna be showing you and previewing you a resource that I've created with all the information from the slides here, and this will also be on it. And then also we will be emailing these out for you, and you can click on them through the PDF link that you'll get of these slides for these resources. So now we'll take questions. If you want to write in the chat box, please, instead of unmuting yourself. I'll have Veronica respond. We'll just wait a minute or so for any questions. Okay, I'm gonna move forward. Going over this resource I mentioned, we're gonna be publishing soon and we'll email it out to you. Everything that we went over in the webinar, it's about 4 pages and it goes through the best practices, identifying languages, interpreter roles, some commonly used language line companies, and those resources I mentioned, full language access. Oh, we do have a question, Veronica. Which company has more Indigenous languages available for interpretation? I'm not sure. Maybe Veronica knows.
So I'm not sure, but in your resources, you have the directory for translation interpretation services.
Mhm.
So if you're gonna send this information to them, I think it's at the end in your
Through
resource.
email, we'll send out the links from the slides, and they're the
So
same.
in that link, you can find these people that specialize in having interpreter services for the people from Mexico and Guatemala. They have variety of indigenous languages, and sometimes it's very hard to find companies that have this type of interpreters because it's not a lot of people that speak the language. But in the resources from this webinar, you're gonna see all these people listed with the information.
Okay,
And
we have another question. What is a polite way to tell someone that you would prefer to use an interpreter over a family member that they brought with them?
yeah, so and sometimes when the interpreter, we can use the same thing. When we have the interpreter and hi ma'am, I'm gonna be your interpreter, and I don't need an interpreter because my friend is here or my cousin is here for me. And the provider has the right to keep the interpreter for them. And you can say, okay, no problem, ma'am. We're gonna have this little sheet of paper that is just saying that you won't like the interpreter at the clinic or you won't like the qualified interpreter on the phone. So that you're gonna use your family member, is that fine? And they usually sign that documentation. And then if the provider wants you to stay in the room or the provider wants the interpreter for his issue, for his use, you can just say, I'm gonna stay in the room for the provider if they have any clarification. I understand you don't need an interpreter and you don't want me to interpret for you, but I'm gonna be here for the provider or for the medical staff if they have any questions.
Great, thank you so much. That's everything. I'm gonna pass it over to Katie. Thank you, Veronica,
Thank you.
for speaking.